Yes, thank you, Dolku Media, for this information, which I believe will reach most of people. Right now, I'm speaking to you. We don't have a coronavirus in South Sudan. Yesterday, people were panicking simply because we had an alert from somebody who is residing in FX Hotel. Immediately when we had this alert, we mobilized our team and he was brought to the center, IDU center, where we can isolate people and take samples for testing. And this is what we did. The whole of last night he was under care, and this morning we took sample, and at 1:30 the results came negative. So I assure people of South Sudan, up to this moment we don't have case in South Sudan.
Can you tell us that?
Having said that, now all the corners of South Sudan, all the countries, Congo, Kenya, Ethiopia, Sudan, they have reported imported cases, except Uganda. And we as South Sudan, we are not living on an island. We are part of the world. We are safeguarding ourselves, but you never know what will happen. Before that happen, we urge people of South Sudan that just do simple measures to protect yourself by, one, avoiding handshaking, two, continue washing your hands with soap or sanitizers or any alcohol-based sanitizer you can use. For people who are living in rural areas where you don't have soap, you can use the ashes to wash your hand. Again, also don't touch your mouth, nose, eyes. When you are coughing, cover your mouth, sneezing, cover your nose, and dispose of whatever tissues you are using in a safer way. These simple measures can protect you, can protect the country.
Can you tell us if there is any suspected case right now, or there are no cases at all?
This morning we also have an alert from Malakal, and a sample has been collected, and this sample is on the way coming to Juba. It will also be subjected to testing, and by 7-8 tonight we'll know the results.
And can you tell us if there are any restrictions, travel restrictions in place, which airlines?
Yeah, yesterday the government has passed some restrictions. The restrictions are based on if a country has established local transmission of coronavirus. In other words, the communities are directly affected. There are no longer people coming from outside, either Asia or China, Europe, Arab world, some part of Africa. If we establish that country, we have a direct flight with them, and they have local transmission. I am afraid that we may ask them to restrict or stop their flight coming to South Sudan. That is advice we'll give to the government authorities as Minister of Health.
And what advice would you tell travelers, both incoming and outgoing?
Those who are coming, we will tell them, please, if you don't have real right business or essential business in South Sudan, why don't you defer your coming to another date? If you have that essential business in South Sudan, you're welcome to come to South Sudan, but upon arriving to the Juba International Airport or any other port of entry, you will be required, after screening you, finding you don't have any symptom showing that you are a carrier of a virus, you will be allowed in, but you will be self-isolated.
How prepared are you in case there is any outbreak?
Yeah, in case there is an outbreak as a country, yes, we have measures in place. As I told you that we have a small unit for isolation. Once we have cases, that unit will be expanded for quarantining people who have been found positive. But we are always asking people to self-isolate themselves who are coming to the country. They should observe that. They should remain indoors, get their food, their water, whatever they want, they get it indoor, but not to mingle with the population. And also, if we start to have cases, then we will ask the authorities to ban many social activities, including going to church. That will happen. But right now, God is with us. We will not reach that stage.
Can you
A good example is one of the Muslim countries. For the first time, they have banned nobody should go to mosque for prayers. And these are people they go to mosque 4 times a day. 5 times a day. For us, majority of us, yes, we go to church on a daily basis, but commonly, majority of huge gatherings happen on Sundays. We may be compelled to ask our people to avoid that. We have South Korea, which have huge congregation going to church on Sundays. They have already banned that. People pray in their houses. Abuna always will be standing in the church, do the normal services, but everybody is listening, sing a hymn, everybody will sing, sit down, everybody will sit down, pray, everybody will pray. So we may be compelled to do that.
Can you tell us about your ability to test cases here? What can you say about the lab? Where are you testing the cases at the moment?
We are testing them in here. This maybe 20 meters away from here. We have a credible, well-trained team. And right now we have 4 alerts. 3 were tested in Uganda before our capacity was not that enough. But right now, the alert of yesterday was tested here in South Sudan, in this national laboratory, where actually the lab of virology is well equipped with reagent, primaries, and the personnel who are able to get us good results, standard results.
So when you speak of alerts, there is the French national. Has he been discharged? And what are the other cases?
Yeah, this person has been discharged. Actually, he came from France, but he is an Australian citizen. He has been discharged. He came together with his wife. Yesterday they were together. We examined both of them. The wife did not show any symptoms, so she was left alone to continue self-isolation. And we took the husband, brought it to IDU for further investigation. Investigation were completed this morning, and the results has shown negative. This gentleman now is discharged, and he will continue with the treatment of a normal flu, not coronavirus.
And what are the other cases?
Yeah, we had an alert from WOW and also an alert from Malakal. Both alerts are coming from enemies. I believe these are soldiers or officials who are working with enemies. The one of Malakal is an official working for MSF France. And this man today, the team there took samples, and this sample has been sent to Juba. So the results will be out at around 7 or 8.
On resource mobilization, what has the government done so far? What does it intend to do?
Yeah, on resource mobilization, as I earlier mentioned, the government is in a transition of establishing full swing operation. Up to this moment, we are still having a lot of challenges, but we have put already the budget in the Ministry of Finance. They are working on it. We believe soon or later we'll have the budget from the government. As for partners or donors, yes, we are still working with them. They are urging us to improve the amount actually allocated. we were basing our budgeting on Juba only and the Nimili border. But now all the borders are actually on standby. So we believe South Sudan, we shall budget for South Sudan as all, not only Juba and Nimili border. So the budget will increase.
What is the last thing you can say about your department when it was created and your mandate?
Yes, this department has been there only with news of coronavirus outbreak or COVID-19. We met as Minister of Health, and I was put to be incident manager for coronavirus. And I mobilized all the teams. We have 9 pillars. These 9 pillars, we have all the teams included, the surveillance, the coordination, the laboratory, the infection prevention control, port health, which is actually taking care of points of interest, and anyway, 9 of them.
And many people are ignorant about coronavirus, how it is passed, how people get it. What can you say about that?
Yeah, we'll always say it is passed through droplets. If somebody sneezes or coughs, that person can push out or sneeze out droplets. Those droplets, if you are about less than 1 meter away, for sure you can inhale the droplets. If that droplets contain virus, then you get it. And this is why we are asking, keep distant from people, and gathering should be avoided. Too much people gathering should be avoided. So that is the only way you can catch the virus. The other way is that if that virus on the surface, for instance, you touch your mouth, your nose, and then you touch a surface, and somebody innocent also come and touch that surface and put his hand or her hand on mouth or nose, eye, the virus could be getting you.
What are the key symptoms people should look out for?
That is very tricky. The symptoms look like normal common cold, flu, fever, cough, difficult breathing. So these are the symptoms. I mean, that you should try to, and we are urging the population, once you develop these flu-related symptoms, contact your doctor or go to hospital.
And there is a hotline. What is that?
It is hotline. When somebody should be calling, it is 6666. Call that line
4 times.
4 times, and you will get somebody who will answer you. Of course, there is a team who is qualified to classify your flu, whether it is related to corona or it's just a normal flu.
Are the doctors or the health workers handling these cases? How safe are they?
Yeah, we are putting out a lot of sensitization to health workers so that they safeguard themselves. We have not yet distributed massively all the masks or gloves, but we are telling them that let them be cautious always. If somebody suspect, they keep distant and they do the necessary for the patient.
Thank you very much.
Thank you.